Perhaps you've been suffering from burning, gritty, sore eyes, or perhaps even watery eyes that don't seem to respond to any treatment whatsoever, and you've been through every kind of dry eye product on the market, it seems, with no luck. Well, in this video I'll explain some important considerations that could make all the difference between you successfully having your dry eyes treated or not. Hey, what's happening? This is Martin's Eye Tips with me, Optometrist Martin Oguzie. This channel is all about helping you to see better, see more comfortably, and also be less anxious about your eyes. Please subscribe to the channel, hit that notification bell as well. That way you get reminded every time I upload a new video. So this is the final video in a three-part series designed to give you the basics on what dry eye is, its causes and its treatment. In this video we'll be covering its treatment, and like other videos in this series, I'm going to draw from the leading Dews 2 research to give you what I think is a very important overview on treatment strategies that may help to explain why some treatments work and others don't work at all. Now hopefully you've been watching the other two videos in the series. If not, go back and watch those first using the link in the top corner just over here, then come back to this video for a fuller context. So when it comes to treating dry eyes, you must know whether you're treating one of two types of dry eyes. So first of all, aqueous deficient dry eyes or evaporative dry eye. Now, as a quick reminder, aqueous deficient dry eye is when you don't produce enough tears, and evaporative dry eye is when your tears evaporate away too quickly. Now, once you know which broad type of dry eye you have, then you need to know what is the underlying cause of your aqueous deficient or evaporative dry eye. Now, obviously, this is the job of your optometrist or your ophthalmologist to figure this stuff out. But once they know, I think it's important for you to know also, because you can then take charge of your dry eye recovery if you are aware of what exactly is going on. So my tip is to ask your eye care professional these two questions. Firstly, do you have aqueous deficient or evaporative dry eye? And secondly, do you know the likely cause of your aqueous deficient or your evaporative dry eye? Now, most eye care professionals may not tell you this stuff unless you ask, simply because they don't want to confuse and overwhelm people with too much information. Now, as I pointed out earlier in the second video of the series, all of the ways to go about treating dry eyes should really involve treating these three aspects. First of all, the tear instability, tear concentration or osmolarity as we call it, and inflammation. Tears become unstable mainly because the outer oily layer of your tears may become low in supply, and the main cause of this is blockage or clogging up of the gland that releases the oil, and we call this gland the meibomian gland, and we also call the condition meibomian gland dysfunction or MGD. Now, you can also have problems with the mucus layer production from the mucus producing goblet cells as we call them being low, particularly when evaporative dry eye has been going on for some time. The result of all this can be that your eye may sting when it's overly concentrated, or it may feel sore, blurred, or even watery. Treating new cases of relatively new evaporative dry eyes. So first of all, eyelid hygiene and keeping your eyelids regularly clean from oil and bacteria clogging up is really important, particularly in conditions such as blepharitis, where the eyelids may become inflamed, and this may be due to bacteria. You can use dilute baby shampoo to do this with a cotton bud just to wipe around the lid margins, but I think even better is to use some of the specially created eyelid hygiene wipes just to keep that area nice and clean on a regular basis. Hot compresses with a heat mask is excellent at helping to unclog the meibomian glands with a gentle eyelid massage routine. And it's also worth noting that hot compress and a good eyelid hygiene routine can potentially be enough to cure evaporative dry eye. Now, lubricating eye drops are a source of immediate eye relief from sore, gritty eyes, and there are a huge number of lubricant eye drops on the market, and it's easy to assume that they all do the same thing or try and achieve the same thing. In reality, some are better than others for your type of dry eye. If you find that your eyes are watering a lot, this is usually because dry patches are forming in the tears, and this triggers your eyes to, when your watery glands, to produce excess tears to try and fill in the gaps. A bit like the triggering of tears that happens when you chop up onions. And in this case, you might want to try a carbomer based lubricant such as Visco Tears, and these are good at having a longer retention time on your eye to fill in the gaps. Now, if on the other hand your vision consistently goes blurred because as the water evaporates, it leaves more of the mucus layer, which then may also get thicker, then you should consider using a lubricant product that has mucolytic properties. And that's to say that it contains agents such as glycerin or acetylcysteine, which are designed to break down the excessive mucus and reducing the blurriness at the same time. As well as these, some lubricants are designed to replace the oily layer of your tears, while others may try and mimic the complete composition of your tears altogether. So selecting the appropriate lubricant drop for your type of dry eye may make a significant difference to the overall comfort. To treat long-term chronic cases of evaporative dry eye. Now, the problem here could be that an ineffective treatment that has been going on for some time has led to inflammation to build up. So in these cases, it may be that the sufferer may need to use steroids for a short term to get the inflammation under control, and then after which you may well find then that the hygiene regime and the lubricants may work a lot more effective. Aqueous deficient dry eye treatment. And when it comes to aqueous deficient dry eyes, this is usually the most serious of dry eye conditions because it's often linked to whole body systemic health conditions such as autoimmune conditions. Now, because your eye doesn't produce the water component of your tears sufficiently, it's important to get medical treatment in the initial stages to manage the condition, and particularly any inflammation that may be present. Now, as far as dry eye is concerned, inflammation is really the biggest threat to healthy eyes. If you are somebody who, for example, has tried everything or feel like you've tried everything to soothe your dry eyes, apart from seeing a dry eye specialist, then it may well be the case that you actually have aqueous deficient dry eyes, but you've simply been treating it like it was evaporative dry eye, and that simply won't work. And it can in fact be something that leads to more long-term worsening of your symptoms, or even a worsening damage to the surface of the eye. The treatments for aqueous deficient dry eyes include, first of all, we want to make sure that we retain the small amount of tears that you may well be producing by limiting or blocking the drainage, and we do this using little plugs that go into the drainage holes. Treating inflammation with steroids or non-steroidal anti-inflammatory drugs such as methotrexate where necessary. Another popular option is to use cyclosporin based drugs such as Restasis to try and stimulate the production of extra tears. It may be worth considering the creation of personalized blood serum eye drops from the individual's own blood supply. So there are many more tools and treatments, and all of these should be used on top of the normal eyelid hygiene and lubricant options we talked about for evaporative dry eye as well. It may not be possible to cure aqueous deficient dry eyes unless you can get the tear production levels up, but it should be possible to minimize the symptoms that can be so disabling for sufferers of dry eyes. Now, the other key thing that is important for treating dry eyes over the long term is having a consistent dry eye regime. The aim here with the dry eye regime is to keep your dry eyes free from inflammation and to allow your eyes to recover naturally as much as possible. So also very important in dry eye regime is nutrition, and particularly in the case of aqueous deficient dry eyes, nutrition is critical to dealing with inflammation and helping to get it right down, and it really should form part of any long-term chronic dry eye regime. Research suggests that one of the reasons that many people don't have success with their dry eye treatment is because they really don't continue with the treatment and any regime for a long enough period of time, with most people stopping their regime before 2 weeks. And and typically I would recommend about 5-week system designed to be intense in the first 2 weeks and then gradually reducing the intensity over the following weeks. So in my experience, consistency and intensity is really the key to getting dry eye under control. Now I'm interested to know what you have tried for your dry eyes and whether any of it has worked before. Leave me a comment in the comment section below, and I look forward to reading your thoughts and your experiences in the comment section. There's so many things that I could have covered over this 3-part basic dry eye series, and I could have gone into a lot more specific detail, but the plan here really is to give you somewhat of an introduction to dry eye over this 3-part series, an overview of treatment options. But I plan to be back with a lot more detailed information on treatments, product reviews, and other useful tips for dry eye management on this channel. Please make sure to stay tuned, and for more help with your dry eyes, please check out the description box below, and don't forget also to subscribe to the channel and hit that notification bell as well, so you get reminded whenever I release a new video. You can catch the rest of the series if you missed any of the videos in the 3-part series by just checking out the playlist over here in the corner. Thank you so much for tuning in, and I really look forward to catching you guys in the next video. Take care.